Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on surgical defect that is seen on a CBCT scan. So basically patient had come with a chief complaint of a surgical defect, that is a hole in the palate. Okay, so patient basically had a mucosal lesion on palate, some kind of non-cancerous benign papillary growth like lesion that was seen on the palate. So after 2 to 3 weeks of surgical excision of the lesion, there was a hole that was developed in the palate. Okay, so patient had patient was basically referred for the CBCT scan to check the status of the palate. So we took a CBCT scan for the same. Okay, so as seen in the coronal cross section, we can see the discontinuity that is noted in the upper right side. Okay, so this is the right side, this is the left side of the palate. So upper right side, somewhere in the premolar and the first molar region, the second premolar and the first molar region of the right side, the defect was seen. Okay, so as seen in the coronal cross section, you can just see this. There's loss of there's discontinuity that is noted, loss of bone, and the nasal turbinate has been exposed. Patient had difficulty in speaking. There was speech anomaly and nasal regurgitation. You can see the normal left side, the bone is well seen, and the mucosa is also preserved. The soft tissue lining of the left side is also well maintained, as seen in the right side, where it is discontinuous erosion is noted. Similarly, just like this is the coronal cross section, you can see the axial cross section as well. Now we'll just take this thing up. So this is the axial cross section, not very well appreciated in the axial also, but the circular mass that was seen in this image, the circular circular entity surgical defect, it is seen as a radiolucent entity in the axial cross section. And a similar defect if you want to see in the sagittal cross section. So this is the sagittal cross section, we'll just hide the lines. So this is the defect that is seen. The exposed nasal turbinate is also noted. So this is the right side, and we'll just see the normal left side. Okay, so this is the normal left side. In the normal left side, you can see the soft tissue and the hard tissue palate continuity that is noted. This is the palatal floor or the nasal floor. The palatal mucosal tissue is well evident on the left side. We'll just take this thing to the right side. You can see there is slight initial discontinuity that is noted. Okay, the soft tissue as well as the hard tissue, both are missing. So this was the case. You can just see this thing in the 3D volume also. Now since patient has lot of restorations in the, as you can see in the axial cross sections, hence a lot of beam hardened artifacts are seen in this. So 3D volume rendering images in such cases become totally unreliable, but still you can just with the help of some metal beam hardened artifact reduction tools are there, so you can just use that filters if available, and you can just see the thing in the 3D volume. We have just made an axial cut, so this is the thing that is seen in the axial cross section, the circular defect that was seen. Okay, so this is the thing. Similarly, if you want to see this in the bird eye view, so what you'll do, you'll just we'll just cut this thing from the top, okay, as well, and we'll just see, not very well evident in the bird eye view, but you can just see this thing. So in such cases, it is not very well evident. 3D volume render images does not give much information as what we can see in the grayscale images. In the grayscale images, you can do the markings as well, like the length, everything can be known, the size of the lesion can be known. This will help in the follow-up scan. Suppose if the patient, after this the patient undergoes treatment for the same, so in the follow-up scan, maybe after 6 months to 1 year, the size of the lesion can be reduced, and if the lesion now is around 9 after a few months or a year, the size may reduce up to 2 to 1 So this grayscale images are more helpful in comparison to the volume rendering images in such cases, because volume rendering images will definitely always give you some kind of artifacts. As you can see this, the left side does not have any kind of a radiolucent entity. Only the right side has the surgical defect, but still in the volume rendering images, this thing is seen, the whole like thing is seen on the left side, but actually left side is normal, only the right side is the main area of concern. So in such cases, always the grayscale images become reliable. Okay, so this was everything about the surgical defect as seen in the CBCT scan. You can always see this thing in the axial CMPR view. So we'll just divide this thing. We have just already made the division. So this is the lesion. So as seen this, uh, we'll just take it towards the surgical defect part. So this is the surgical defect part. This is the nasal turbinate, the area of concern. This is the area of concern. Okay, so we can give a quick marking as well over the specific part, so that in the follow-up scan, suppose if the patient comes after 1 year, we'll see the closure of this defect, or with some help of some kind of graft or whatever the treatment plan may be, so it can be known. Okay, similarly, we can always use do a bilateral comparison for the same. We'll just divide this thing into two and just see the area of concern. This is the right side and this is the left side for the bilateral comparison. Similarly, you can just do this, like check it from the palatal cortex area. You can just do bilateral comparison, left side versus right side. So this is the right side thing. So right side, you can see this is a sagittal view. You can see the defect that is seen, and the left side you can see the normal bone, palatal bone, and versus the right side. Okay, so this was everything about the surgical defect.